Today, I think we should pause and talk a little bit about where we are in this coronavirus and where we're going. In a sense, you can liken this to halftime, middle of the game. No one knows exactly if we're in the middle, but probably not too far away from that. And I'll talk about that in a moment. But let's first go to our slides and look at the data for today. Today we are reporting 1,447 new cases. To put this in perspective, in the last 7 days, our cases have averaged close to that, a little bit over that, 1,475 cases per day by report date. We had been averaging, to put this in perspective, a little over 1,000 cases per day only 2 weeks ago. So we've gone up quite dramatically in several weeks. Let's look at the positivity, another way of looking at this. As we increase the testing, we would hope to be seeing a drop in positivity. We're not seeing that. This is a chart that only goes back, and I want to make sure everyone understands, this goes back to July 1. So we got from July 1 basically to the present. And you can see what's happened. Our positivity is now showing for the last day 4.1%, 3.9% for the last 7-day average. It was 2.7% on September 23rd and 24th. So again, these numbers have gone up dramatically. Let's take a look at our top 88 counties. And what you will see here, again, these numbers just continue, these numbers unfortunately just continue to go up. Athens and Fayette County are both, and Putnam, Mercer, Darke, all those counties are about 3 times what the high incidence level of the CDC. So it's just off the charts. And then we go on down from there. So again, starting Athens, Fayette, Putnam, Mercer, Darke, Auglaize, Jackson, Butler, Henry, Miami, Fulton, Allen, Ross, Shelby, then DeGreen, Clark, Montgomery, Scioto, Lawrence, Muskingum. Those are the top counties as we move forward. This map now shows how many counties are red and how many are high incidence. So the red counties, you can see, if it's a high incidence level, that simply means that they're over 100 cases per 100,000 for every 2 weeks. So we're now seeing 51 of our counties that are high incidence counties. And that's just a real problem. What this means is we've seen this spread. And if you look at this, if you're in a high incident county or you're a red county, you know, we certainly should be concerned. We're not trying to scare anybody, but these measures have never looked like this since we've done this. We never had as many high incidence counties, and we certainly have a lot of red counties. So if you look at, for example, the western side of the state, 2 counties in, every single county looks like it's high incidence or a red county. And this really shows just how this virus has spread out throughout the state. And again, if your county's red or high incidence, that's a big concern. So let's step back for a moment and kind of look where we are going. As I say, maybe it sort of like being at halftime. And I get questions all the time. Mike, when's this going to be over? Governor, when I can take off my mask? I'm sick of the mask. When can I do that? What's our goal? What's Halloween going to look like? What's Thanksgiving going to look like? What's Christmas going to look like? Next year, baseball, and on and on. And these are the things that we all ask ourselves. The truth is that no one can answer these questions with great certainty. What we can say is that things will get better, but in all likelihood, they will get worse before they get better. And we're already seeing that in the trend lines of the last several weeks. Virus is tough, it's cunning, it will not give up, sort of has a mind of its own. And all the experts that we talk to for months now have said, when the cold weather hits, more people move inside, we can't really be outside as much, that's when we're going to see more spread. But I think it's important for us to look at, before we look at the future, and again, no one can predict the future, but I'll base this on what the experts tell me and people I talk to. I spent all day yesterday on the phone talking to more people, many of them around the country who've been following this very, very, very closely. I think it's important, though, to talk first about what we've achieved, because we've achieved a lot. You have achieved a lot. Ohioans have done exceedingly well during this. If you compare us with other countries, if you compare us with some other states, we're doing pretty well. And what we've really avoided, because of what Ohioans have done and what they've not done, what we've really avoided is this huge spike where we would see our hospitals overflowing. We all remember first seeing those stories coming out of Italy. We've seen them come out of New York. We've seen them come out of California and Texas, Florida, more recently, Mississippi. Now we've seen high incidence up in South Dakota, North Dakota. So despite the great tragedy, 5,000 deaths, many families where both parents are out of work. We've seen small businesses close. We've seen small businesses struggle. We've seen an increase in people with mental health problems. So this virus has certainly not been benign, and we have not been spared, and the people of Ohio have not been spared. But because of what you have done, we've gotten to where we are today, and we're in better shape than we would have been if you hadn't made the sacrifices. So many of you have worn masks. No one wants to wear a mask. We all get tired of it. So many of you kept distance. So many of you have done the basic things that we know that we have to do. So I'm proud of where we are. Not proud of me, but I'm proud of what you have done. You've really made a big, big, big difference. We've avoided these large outbreaks that other countries and other states have seen. We've certainly seen more deaths than we want, more cases than we want. But we're doing well compared to many states and to countries.